I'm the director of the St. Joe Community Health Foundation. I know many of the faces in here, and I'm delighted to meet a few more new folks who've joined us today. We have an important and a really good conversation that I'm excited about. And normally when we have these prenatal and infant care or PIC luncheons, we like to have everybody just quickly introduce themselves because it reminds us how many great people we have in this community who care about this issue, care about moms, and are helping us to find childcare solutions for these families. So I'm going to ask, do you have a portable mic? Jackie Martinez is our Community Impact Director, and do you want to pass it to? Okay, that's fine. Where do you want to? And we just ask you to kind of say your name and your agency briefly. If you wanted to make a quick 30-second announcement, that's fine. But to know all the different agencies and individuals in the room.
Okay. Hi, I'm Bonnie Doolittle, New Mercies Ministries. I'm the executive director there.
Good morning, Mindy Theard, Family Coach Manager with New Mercies Ministries.
Hello, my name is Ruth Reynes, and I am an ECHO worker at Catholic Charities.
My name is Mary Wyatt. I'm a student here at St. Francis, and I'm interning at Catholic Charities.
Hi, my name is Madeline Stewart. I'm intake for Healthy Families at Iris.
Hi, I'm Colleen Harlan. I'm a nurse manager at a Hope Center. We have locations in Columbia City and 2 locations in Fort Wayne.
I'm Angie Richard. I'm from a Hope Center. Also, I'm the center manager at the Hobson location. Hi.
Hi, I'm Ann Kale from the Women's Care Center. I have 3 centers in here in Fort Wayne. I'm director.
Hi, I'm Jessica Alvarenga, and I work at Iris, and I work at the Family Resource Center.
Hi, I'm Britt Neihart. I am the supervisor for the Women's and Children's Nurse Navigators at Parkview and Allen County FEMA coordinator.
Good morning, Belinda Dean, Neighborhood Health Clinic.
Faye Williams Robbins, Fort Wayne Community Schools.
Good morning, Pat Turner with Tobacco Free Allen County.
Good morning, Nastasia McCollum. I'm a case manager with Catholic Charities.
Hi, I'm Laura Lahr, a midwife with Parkview and at Alliance Health Center.
Hi, I'm Tiffany Bailey, Program Director at Healthier Moms and Babies.
Hello, Maria Martinez, Intake and Assessment Worker with Healthier Moms and Babies.
Lisa Pickerman, Follinger Foundation. I'm a program officer there.
Amanda Jamison, Chief Program Officer at Follinger Foundation.
I'm Angela Stanley, Director of Impact at the Community Foundation.
Hi, I'm Julie Von Gutten with Journey Beside Mothers.
Hi, I'm Julie Reese with Journey Beside Mothers and the Wellness Nurse and Director of the program.
I'm Angie Phillips with Lutheran Social Services with our ECHO program.
Amelia Clark, University of St. Francis.
Hi, Jeannie Stroh with the Department of Child Services.
Brittany Fields, Department of Children's Services.
Erin Edmondson from the Department of Child Services.
Andrea Caldwell, DCS.
My name is Jessica Davis, and I am with Turnstone.
My name's Audrey Leonard, and I'm with Turnstone.
And I'm Kathy Bear, and I'm also from Turnstone.
Hello, I'm Diamond Mims, Children's Services Coordinator at the YWCA.
Hi,
Hi, I'm Renee Cleland. I'm a doula with Healthier Moms and Babies, and I'm also part of the doula network of Fort Wayne.
Alyssa Opry, I'm a labor, delivery, postpartum nurse and a postpartum doula with Doula Network of Fort Wayne.
Teresa Bauer, nurse at Hope Center.
Hi, I'm Lisa Castle, and I'm with Brightpoint's CCDF program. I'm the Family Support Services Manager.
And I'm Allie Sutherland. I'm the Executive Director of the Northeast Indiana Early Childhood Coalition.
Thank you all for taking the time to introduce yourselves. I did want to also do a quick shout out thanks to the people who didn't introduce themselves in the mic who are part of the St. Joe team. Marla Rust greeted you in the back. Mark Burkholder has helped us put all this together, and then Jackie Martinez. So I'm privileged to get to work alongside of them. You have an agenda in front of you, and normally on these, the Prenatal and Infant Care Network, if this is your first meeting, we do meet quarterly. It's free, but we meet on topics that you all have determined we need more discussion and know best practices, who's doing it in the community, and to share knowledge. So today, childcare is the topic that many people said we need to dig into it, learn about why it's important, and just some of the local resources. Before we go too deep into childcare, we want to talk about, we start with, unfortunately, some of the most difficult side of it, where children have been injured or harmed, or worse yet, have died as a result of poor child care. And the Fetal Infant Mortality Review Team in Allen County has the difficult job of looking at these worst outcomes to make sure that they don't happen again. Leading that team for the county is Britt Neihart, and I'm going to have Britt come up and kind of give a report related to child care, why this is so important.
I put together a few examples of cases and things we've seen in both FEMOR, which is the Fetal and Infant Mortality Review cases, as well as the Child Fatality Review that I'm a part of in Allen County also. The unsafe sleep or the SUIDS deaths are reviewed in that meeting. In general, we see in the FEMOR cases that many of our mothers are feeling a lot of isolation and just have a lack of support. They don't have a lot of family. Some have no family at all. You know, oftentimes there's no father or baby that's present and helping. So that leads to just isolation, feelings of depression and anxiety, and they just never have a break. Some of them would like to go out and get a job, at least part-time, but they don't have childcare, at least not affordable childcare. So a few examples. We did have a 5-week-old infant that died due to an unsafe sleep situation. The 15-year-old brother was in charge of babysitting every evening, and normally he would put the baby to sleep in a swing in his bedroom, just because that was their routine. But on this particular night, he had asked his 13-year-old sister to watch the baby for a little bit so he could play video games. He lost a little bit of track of time and was playing the games longer than he usually would, and when he went to go get the baby from his sister, he found that she and the 9-year-old sister had put the baby between them in the bed and went to sleep, and the baby was not alive. So that was one really tragic example. Another mother told us during her maternal interview after she lost her baby that the loss was due to a congenital anomaly, so it wasn't really a preventable loss, but she said she would have liked to have utilized some of the community resources that she was told about during her pregnancy, but her husband had a really hectic work schedule and she didn't have childcare for her other children, so she wasn't able to. So we do hear that a lot too. They would like to participate in some of the wonderful resources we have in this county, but it's hard to get there when you have little ones that you have to bring with you. And then I have a couple of examples of respite care situations. We definitely are seeing more and more women tell us during their pregnancy that they don't have anyone to leave their child or children with when they come into labor and delivery to have their babies. They have no family, they just have no one. So that's a really stressful thing, and whenever you increase the stress on a pregnant woman, it increases her risk of all the negative outcomes that happen. So we do try to help connect them with the agencies, which you'll hear some of here today, in the area that offer that respite care. But if they don't know about that, or if they don't admit to us that they need that help ahead of time, what typically happens, I believe, is, and we've got some DCS people here today that would know better than I, but I believe if they show up in labor at the hospital with several young children in tow and nobody to be with them, DCS has to be called and they have to try to find some quick childcare for these children while mom's hospitalized. So it's just a stressful situation, and we like to try to avoid that if we can. And then the last case is a family that had a chronically ill infant that was eventually discharged home on a ventilator after many months in the NICU. The father worked throughout that, but would have to drive then 2.5 hours to see the baby when he had time. So mostly the parents visited the baby on weekends. They had several other children, so mom needed to stay home with them, and then they would go visit baby on the weekend. They had some family support, so they did have a little bit of childcare during that time. But they had another death in the family, and so dad had to take off some work for that. And as a result of all of this, they got a little bit behind on their rent. So just an incredibly stressful time. When baby was ready for discharge home at 7.5 months, the mom and grandmother were trained in the baby's care because dad couldn't be there to complete the training due to work. The discharge instructions said, must be in the care of a trained caregiver at all times. Failure to be in the care of a trained caregiver could result in a catastrophic trach event and ultimately possible death. I just thought that's wow. To get those kind of instructions, like you must be awake and alert and have your eyes on this child at all times or else he could die. Like the pressure that would put on a mother especially. So he was on a cardiac monitor, apnea monitor, and it said he must be on those monitors at all times when not in direct visual supervision of a trained caregiver. And about 2.5 months later, that baby died when one of his alarms went off. Everyone had fallen asleep in the same room with him. Mom and dad kept him in the same room, but he couldn't be revived. So again, some kind of a respite care, I'm sure would have made a huge difference in the lives of this family. So as you can see, it's a huge, incredibly important issue and one that we have a lot of need for in this area.
Thank you, Britt, for that. It's very sobering. My heart goes out to all of those families, and I'm sure it does with everybody in the room. The importance of us connecting with these families and all of you in the room play such a vital role. So thank you for taking the time to be here today to learn. Next, we're going to have Allie Sutherland, who is the Executive Director of the Northeast Indiana Childhood Coalition, talk to us, and she works in strengthening the whole region's early childhood and child care system, and to make sure we're doing it with quality. I've had the privilege to hear Allie talk several times, and every time I learn so much more. So I am going to just turn it over and let her start sharing some pearls of wisdom with all of us.
Like, ooh, I hope I have pearls of wisdom for you today. And also, thank you for that reminder because, as many of you know, sometimes I think the work can feel heavy and it can feel hard, and it's such a good reminder of why it's important to keep going and keep this fight. So I appreciate that reminder today. And now I'm going to kind of shift gears a bit and help us understand childcare in Indiana and what it looks like. So I don't start off with a lot of good news, as you can probably imagine, that the demand is really challenging. And I'm sure all of you working with families who need childcare are probably really struggling to find childcare. And in fact, we know that there is high demand and a very limited supply. So Indiana has a childcare shortage, especially for infants and toddlers, right? We know that there are just not enough spaces and the resources are limited. We know that there are cost barriers, that the average cost of childcare in Indiana is $12,000 per year for an infant and $9,000 for a preschooler, which is very difficult. If you put that together for a family of 4, right, we are struggling to make this work. And we know this creates a lot of workforce challenges, that many providers struggle to stay open due to staffing shortages and funding gaps, right? We know it's really difficult right now for our childcare providers. We hear like it's very expensive, but at the same time, what's happening over here with childcare, and we know that ratios are incredibly important for quality of care, and so our staffing costs get higher because we want each adult to be taking care of only a few children. And when that happens, our labor costs go up, and so it's really difficult to maintain a childcare business, and at the same time, really difficult to afford. So we have challenging situations all around. And the impact on families. We know that childcare costs often exceed rent or mortgage payments, making affordability a major concern. So this is the Allen County numbers. We have demand for care. So we know that there are 20,743 children under the age of 6 who may need care. So what that number represents is the number of children where all parents in the household are working, a census number. Our care supply, we have 291 programs in Allen County and 9,526 spaces. A lot of those spaces, that 9,000, are going to be for 3 and 4-year-olds also. So we have quite a gap and quite a challenge ahead. We also, I would just note that, that 20,000 number, we don't know that all of those children need care either, right? That number is all parents in the workforce, in the household or in the workforce. We don't know how many of those 20,000 children have grandparents that can watch, or how many, maybe one partner works a shift and another partner works another shift to cover. So we can kind of put that number in a little bit of perspective as well too. So I don't want to completely bring the room down, but just to let you know where we are. We also know that our current voucher usage, which is CCDF, is 2,987. So I also think of that 9,526, it's about 3,000 that are receiving any kind of financial support, right? And you think of how many families are paying out of pocket full price for childcare. It gets challenging. This is more, these are the different types of care that are available. So we have licensed and registered care in Indiana, and then we have unlicensed or unregistered care, right? When I had my first baby, I was really lucky that my parents were able to watch him for the first 6 months. They were unlicensed care, right? But this is but great care. We have licensed centers, and a licensed center can serve larger groups. They often have structured curriculum. They're regulated by the state. They are required typically to have higher staff qualifications. There's also licensed family child care homes. I'm going to take this out. There, that's better. Maybe you can hear me better. Licensed family childcare homes, so care provided in a home, but they are regulated and licensed by the state, so they have to follow basic health and safety. They can also have curriculum, and typically is mixed ages. It's usually a smaller ratio for infants and toddlers. Typically, a licensed home can't take care of more than 3 children under the age of 15 months. We also have unlicensed registered ministries, so they are operated by a faith-based organization. They are exempt from typical state licensing, but they must meet health and safety standards. They can sometimes be a more affordable option. They can also participate in the state's paths to quality, often offer curriculum and the same things as licensed centers as well too. And then we have informal and unregulated care. So that can be care by family, friends, and neighbors. It's not state regulated, but obviously is a necessary option for a lot of families and can also be great options. The one challenge is with this type of care that you are not able to utilize a childcare subsidy voucher. Right, so most of the assistance from the state, you are required to be either licensed or registered. So, some key resources to know about for childcare is, and I'm not going to go into these too much because we have the expert here today who will talk about this much more, but we have the Childcare Development Fund vouchers. And so those are income-based financial assistance for childcare. You apply through FSSA, and we have Lisa here who is the expert and does all of that through Brightpoint, and we'll tell you about that. I'm not even going to attempt. On My Way Pre-K is free preschool for 4-year-olds for income-eligible families. So they need to meet certain qualifications, and they are able to utilize that at a high-quality provider, which gets us to our Paths to Quality rating system. So Paths to Quality is our state's voluntary rating system, our quality rating system, where any program can choose to participate. So any licensed or registered program can choose to participate. So that includes homes, ministries, and centers. And there are 4 levels. Level 1 means they meet basic health and safety. Level 2, they're working towards that higher quality care. Level 3, they're implementing a curriculum. And level 4 is they've achieved national accreditation. So the state considers level 3 and 4 high quality. That does not mean that if you found, there are many different paths and there are many different ways you might find a place that is working their way towards that higher quality, and just hasn't had the time to maybe reach that higher level as well too. And then additionally, something that's really important to know about is the state has childcare resource and referral agencies. So it is a state-funded agency that is there to help families find quality care. So for our region, it is the Childcare Resource and Referral Network. And so families can go online on their website, they can on Facebook, they can request help in finding care. They also do have family navigators there. And family navigators will help the families call different facilities to find if they have an opening or ask different questions and can help guide the families. So the good news is you don't have to keep all of this in your head. There is help for that, and they are wonderful and always willing to help. But we know the reality is that at the end of the day, we know that families have to make lots of different choices, right? That there's oftentimes there might not be a space at the time that they need it, or maybe it doesn't work for their schedule. If they have a night shift or third shift, that can be really difficult to find care. And so I think it's really important to help families and guide them in asking questions and not being afraid to ask those questions of their childcare providers, whether they are licensed or unlicensed, right? What we do know about unlicensed providers is that there is not a background check, or there are not the same screenings, right? So having parents keep that in mind, ask questions of their childcare providers. But a lot of times families don't even know to ask if the home or if the provider is licensed or not. So that's a great question to help them know that this is what licensed means, this is what unlicensed means. It's great to ask if they participate in past equality. What are the teacher-child ratios? So how, if they're going into a different situation, how many children will one adult be taking care of, right? That's a really important thing to know, and that can help them make different decisions. How many infants will they take? What kind of one-on-one care will they get? That's really important to ask. What are their best sleep practices, right? Because we have seen some situations where sleeping situations have not been honored, right? And that's really dangerous, and we want to make sure that they're asking those questions. How does the program handle safety and supervision, right? How do they make sure that they have the children in sight at all times? What do they do when they're preparing meals? How do they make sure? These are just great questions, and the more parents are ready and prepared to ask those questions, it helps them build that relationship with that childcare provider and have like good communication and really create that relationship that's important. Also, do they have a daily routine? Are they utilizing a curriculum? What is the child going to be doing all day? What do they do with the infant? Do they make sure that they're getting tummy time, and are they getting all of those pieces that they would need to get? And then it's really important to ask, what are discipline and communication policies? What policies are in place? Can they come visit whenever they want to come visit? Is the child care provider upset if they drop by unannounced? And how do they handle redirection? What does that look like? Some red flags I think that you can guide families is, when there's lots of high staff turnover, that can be really difficult for children, right? Children need that consistent one-on-one care, and when caregivers are changing frequently, that can be really difficult for children to feel secure, to be able to learn in the way they need to learn. If there is a lack of clear policies on safety, health, or emergency preparedness, like those are some things for parents to look out for. And then, of course, unclean or unsafe environments, right? If there's no one coming in to inspect where the children are, making sure that it is safe, that is something that the parent might want to do themselves. And so I wanted to give you a background of the system, what the different types of care look like, what past equality is, how a parent can really evaluate a child care, how you can give them support to do those pieces. But we know that there are so many challenges and yet opportunities as well. So I want to let you know a little bit about what we're working on. Challenges, of course, like we said at the beginning, we have limited availability of infant care. That's one of our biggest issues, right? It is really difficult to find care for a child. Oh gosh, I was going to say under the age of 3, but I mean truly, that 6 weeks to 1 year is very difficult. Because those are the lowest ratios. So in a child care center or a registered ministry that is following past equality, it is 1 to 4. So for every 1 adult, there are 4 infants allowed in the room, and a maximum group size of 8, right? And when presenting to groups that don't work with children in the way that you all work with children, I always ask them to imagine that their friend, their sister, their cousin, whomever tells them that they're having quadruplets, and what they're feeling for that person, and how much work that would be to take care of 4 infants at once, and why we want to just to help people understand why we want to keep those ratios low. And the answer to our capacity crisis is not putting more babies in a room. Because there's affordability barriers for families, and because of this challenge of lower ratios and lower group size, they're having a very difficult time retaining quality staff, because average wage for a child care worker is somewhere between $12 to $15 in Allen County, and $15 is the high-end lead teacher average without benefits. So it's incredibly challenging to keep people in the field. But we do have some opportunities. We are very fortunate in Northeast Indiana that we have a lot of people who understand, who care, and who are focused on this. And the Northeast Indiana Early Childhood Coalition is right now in the midst of launching a TRISHARE program. So we got funds from the Strategic Development Commission to partner with employers to divide the cost of care so we will divide the cost of care in 3. So the grant pays for a third, parents pay for a third, and the employer pays for a third. We have designed it so it is at the cutoff of CCDF, which is 151% of federal poverty level, up to 400% of federal poverty level. So those families that aren't qualifying, who are kind of over the mark, but still need help because of those large bills, how can we help them afford care? And so we are piloting this program. We have our first, at the moment, 8 employers. We received those funds at the end of November and have been implementing. And I get to stand here today and tell you we've had our first family apply. And it's a family of 4, 2 little kids. They are making just over the mark, but really struggling. And with this grant, we're going to save this family $8,000 a year, which I know how you all know that is a life-changing number for these families. And we're excited to pilot this program. We have some great employers on board. We're working throughout the region to prove a model that could help more families, because we know CCDF is in trouble right now. We have recently had to reinstate a wait list for families. So if you have families applying right now, they're put on a wait list that is 11,000 long at the moment, which is really difficult. And we know we need more assistance. We know we need more help. We do have community partnerships. Grow Allen is a new organization that has recently hired an early learning director to help. And she has started at the beginning of February. If any of you are interested in connecting with that county person, happy to connect you. Her name is Jennifer Ledger. And she is really working on what are those capacity needs in our region. And I was going to go back to, yes, sorry, I'm gonna skip ahead because I alluded to this, and I want to make sure that you're aware of this. So we've reinstated a wait list for CCDF in our state. We are short funds, right, and need funds to be able to get people off of the wait list. Currently, the House has proposed $155 million for CCDF vouchers. The governor proposed $362 million. So you can see that difference, and what that $155 million means for us is that there is a potential of around 25,000 children that would not be able to be served with the difference. So we have been working to ensure that, make sure our senators and make sure our representatives understand the importance of reinstating the governor's budget. You all have great stories to tell your legislators and your senators about your family's needs and how important childcare is for them to be able to work for the safety of children. And our legislators need to hear that story. And so I would encourage you, as we are waiting for the Senate budget, to call your senator, write your senator, and let them know your work and how important childcare is and the importance of reinstating the governor's budget. So that's my little plug for today, and I am happy to answer more questions later. But I'll go back to what we are working on and what we obviously need. So CCDF vouchers are incredibly important for families to be able to afford care, but we have limited supply and need more help. So we're working on increasing support for childcare providers, right? We need to help them streamline services. What are those back-end offices services that we could help provide for them so that they are able to put more time back into the classroom, so that they are able to be a sustainable program? And so part of what the Plus is and TRISHARE Plus is creating that shared resource network for our providers. We're working on employer-based solutions like TRISHARE. And then we've been working with our fellow coalition leaders throughout the state to make sure, are we all speaking with one language, and making sure that our senators across the state are hearing from all of us. Because what we hear is they need to hear more from families, and they need to hear more from childcare providers. And I think, how can home visitors help? I think educating families about available resources and financial assistance. I know you all do this. We're here today to help you with that information. helping families navigate past equality and find trusted providers. You know, I think having those conversations of, I think sometimes we have to have realistic conversations. If they can't find licensed and registered care and they need to work, how can we help them make the best and safest decision possible? We could always use your help advocating for childcare funding and supporting policies that benefit families, as we do as well. We always tell people, you know, one of the best ways we can solve the infant crisis is paid family leave. That could be really incredibly beneficial for families. And collaborate with community partners to expand childcare options. So I think we did that one. Resources to know about. Again, I think Lisa's going to tell you more about it, but the other thing to know is Fort Wayne Community Schools offers pre-K. That's a really important resource for families. And it's children who will be 4 by August 1st. Registration typically begins in the spring. They have full and half-day programs depending on the school, but it is a great resource when children are 4 to reach out to. Like, that is an amazing benefit that children get. Head Start, I think Lisa will cover that one, making sure they know those resources that are available. And then there are some locations around our community that offer sliding scale fees. So sometimes I think parents think, I can never afford that, but it's always worth a call to find out if they do offer sliding scale. I know that Children's Villages and Early Childhood Alliance both offer a sliding scale fee for families. So it's based on income. And there's also the Early Learning Marketplace is a place to start looking up different childcares. That's all licensed and registered care can be found there as well. And then I told you about the Child Care Resource Network. They're a great resource because those family navigators will help families call. They'll call, you know, home by home or center by center if they need to. All right. So hopefully I didn't depress anybody too much, and I'll turn this over to Lisa. But this is my contact information. If you have any questions or need any help, I'm always happy to help. And then,
Okay, we've got good homework here. Tell our stories, get them out there to our state senators, and share this important information, how critical it is. I am very excited to introduce our next speaker here, Lisa Castle. Actually, Allie almost introduced her for me, so you know what good stuff she's going to be saying. Lisa has worked at Brightpoint, which is a local nonprofit social service agency here. She's worked there for over 25 years. Since 2012, she has served as a family support services manager, overseeing various assistance programs benefiting from 30,000 families annually benefit from that. So you've seen quite a few cases coming through here. Her resume gives a lot of great information. I think it was also on the website, but I'm going to turn it over to you and enlighten us further.
Thank you. Okay, so Allie gave us a little bit of bleak news about the voucher program, but I do want to share, though it is a little bleak about the wait list, currently we do have a record number of vouchers in Allen County. We've never had this many vouchers out there in Allen County, and just to give you a little bit of a statistic about that, just this past month there were 3,575 children receiving vouchers in Allen County, and with that, I always like to share the amount of money that's going out to our providers. And in February, $2,536,776 went out to providers through the subsidy program. So yes, it's bleak. We definitely would like to see that there's no waiting lists like there hasn't been for the last 3 or 4 years now. But there's a little bit to celebrate. We do have a larger number of vouchers than we've ever had. Okay, so just a little bit about Brightpoint. We are a fairly large agency. A lot of people do know us for the Head Start program. We have multiple locations here in Allen County and also in Noble, Whitley, DeKalb, Huntington, and I messed that one up because I don't remember. We just added a couple, so I'm confused. But we also offer multiple other programs at any given time throughout the year. You're going to see 20 to 25 programs at Brightpoint, from helping families sign up for Medicaid to supportive services for veterans' families. We have lots of youth programs. So not only are we helping with Head Start and Early Head Start, which is infant to 5, but we also have JAG and Focus Forward in multiple counties. So as you can see, we have our hands in a lot of things, but it's all there as supports for the families. So Brightpoint's child care program is actually in the 17 northeast central counties. So the blue area up there are the counties that we serve. It is a federally funded program designed to help low-income families have equal access to child care and educational opportunities. Many of our families are unable to access that high-quality care because it's just too expensive. One of the things we like to do, we typically will call our families as they're reauthorizing and we'll say, oh, and we just want to let you know your voucher is worth $20,000 this year or $22,000. We have a family of 6 that's receiving almost $70,000 in child care subsidy and 6 children. So that, you know, when you explain that, and oftentimes what we're seeing is their child care subsidy is more than their annual income. So without the CCDF program, they wouldn't be able to work. We are what's called the eligibility determining agency. We have nothing to do with payment to the providers. We are really the family support to help determine whether a family is eligible for the program. So as this financial burden of childcare expenses is increasing, we know that that's going to be impact a significant amount of the family's income. And so the demand for assistance is obviously growing. In Allen County right now, we have 622 children on the wait list. And that grows each day. But I did get my numbers just a few minutes ago. Across our 17 counties, we have 21,742 children in quality care with $70 million going out in subsidies. So, Allie alluded to the child care assistance wait list. Over the years, we've had wait lists, we've put all the kids on, we've had wait lists, we've put all the kids on. So we're back to a time when we're going to experience the wait list. How does that impact a current child CCDF family? Well, if they have vouchers, their existing benefits are going to continue as long as they remain eligible. And we hear a lot of people say, oh, they struggle to reauthorize or that sort of thing. So I want you to know some of the things we're doing to help with that. Typically, a family will receive a packet in the mail, but we do know that a lot of our families are transient, so they're moving around and maybe they forget to tell us that they've moved. So we're also alerting them via email and text that they have the next 30 days they need to reauthorize for their vouchers. So we're also calling, just multiple ways we're reaching out to the family to help get them reauthorized. If you need to add a new child to the voucher and you're an existing CCDF family, in the past we were able to just go ahead and put them on the program. Unfortunately, now those children will have to go to the wait list. And I would say that's one of my biggest, I hate that they have to go on the wait list, but we do have to do that. For a new CCDF applicant, once they apply, they're placed on that wait list. We do have priorities set up. One of the first priorities is on my way pre-K applicants. So right now, and by the way, Fort Wayne Community Schools, April 9th, passport to pre-K, Northside High School, 5 to 7, I believe it is. That's where families can go sign up for On My Way Pre-K at any of the schools in Fort Wayne Community Schools. We'll also be there helping to get them taken care of with their On My Way Pre-K application and get them registered for which school they'd like to attend. But priority is first assigned to On My Way Pre-K. Then we have families who earn at or below 100% of the federal poverty level. And then, and I have put some flyers on each of the tables. Those are the updated, most current income guidelines for families to get on the program. They do have a QR code, so if you're working with families, you can scan that QR code and it's going to take them directly to the application for the wait list. The next level is the Children of Child Care Workers. This was just recently passed legislation to allow child care workers to be on that priority list. And we're excited that we've been able to provide those vouchers to some of the children of the child care workers. And then all other applications are processed as a first come, first serve basis. Families are asked to confirm their contact information, employment status, and income every 90 days in order to remain eligible. And we do that in multiple ways. We email, we text, we make phone calls, and there's a letter that goes out in the mail. So multiple ways we're reaching out to those families to ensure they continue to be eligible. So what are the qualifications for a family to get on the child care program? A parent or guardian must be participating in a valid service need. Well, what is a valid service need? Working, going to school at an accredited school program. So unfortunately, if they're like doing a CNA class at a local nursing home, that doesn't count. But an accredited program will count, and they can be doing classes online, so it doesn't necessarily have to be going out to school. Or they can be job searching on their initial time getting on the program. We will need proof of identity for all household members. We will need their gross household income has to be at or below the 150% of the federal poverty guidelines. The child or the children have to be a U.S. citizen or qualified legal alien. So not the parents, but the child receiving the services does have to be. Children will receive care must be under the age of 13, or they can be over the age of 13 with documented special needs until their 19th birthday. And then they must attend a CCDF eligible provider. Well, an eligible provider has to meet the minimum standards. They don't have to be licensed. They do have to meet the minimum standards. And those minimum standards are your mainly your health and safety requirements. I'll just let you know what a few of them are. They do have to do a background check. They do have to have CPR and first aid. They have to go through a safe sleep training. They are limited on the age of who the caregivers are. Those homes, even though they're not licensed, are subject to visits from FSSA members. They do have to notify us of any injuries or hopefully not deaths of children in their care. And they do have to provide some sort of daily activities appropriate to the age groups of the children, and they'll have to notice that. Now that's the minimum standard. And then of course our licensed centers, registered ministries, our license exempt school programs, most will accept CCDF vouchers. So what happens when you're on the waiting list? Well, there's certain documents they need to be gathering for their enrollment. One is proof of residency. We will need a picture ID for the applicant. We'll need proof of ID for all of the children. So that can be like their birth certificate, their birth confirmation letter. It can be the immunization record. I mean, there's a multitude of items that they can use for that ID for the children and co-applicant. And I do have to stress that it is all children. That's one thing that many families, they only put the child that needs care on the application. It's all children in the household. And then they'll need service need verification. So for those that are working, that tends to be their income documentation as well. So it can, the pay stub is the main item. And then we do have a few additional forms. There's an applicant worksheet, which just gives us some brief information about the family that we'll be determining eligibility for. They'll take a provider information form to the provider of their choice, and that is another item with CCDF. We cannot refer families to any particular provider. It's a family's choice, so they can choose what provider they want. So what you'll find on our website is we have a link to the Childcare search, and we have the Childcare resource and referral networks number there for them to reach out to. And then if they're applying for On My Way Pre-K, they do have to sign a parent agreement. There are some parent engagement activities that they have to take care of with On My Way Pre-K throughout the year. But honestly, the state has really lightened the documentation that they need. For example, we can take one pay stub from any time in the last 60 days. Used to be, had to be within the last 30 days. Now we have 60 days for most of our documentation requirements. And they've really lightened up what we're allowed to take for like residency. Used to be a utility bill or official mail from FSSA. Now, pretty much any type of mail will work. Oops, wrong way. So there are a few things that we are doing. One is I do want to let you know that 96% of the families receiving the CCDF voucher through Brightpoint are employed. So they are working in our communities. And they do have multiple ways to submit their documentation. A lot of times, again, that's a concern that we hear is that, oh, it's too hard to get my documents there. They can email, they can text, they can drop them off in our drop boxes, they can mail them, they can fax them. There's a multitude of ways they can get those documents to us. Indiana does provide a 53-week voucher. We're not allowed to provide any less than that. So if I have a voucher for my older child, and if the governor's budget gets approved and we're able to put a few more of those kiddos on, and I have a younger sibling that's going to get on now, we're going to extend those vouchers out so that all the children in the household are receiving the 53 weeks. We try to do things so that it ensures no undue disruption of the parents' employment to maintain their eligibility. We have virtual office hours. We have those in the evening and during the day. They can also, like I said, we have drop boxes at all of our offices. There's just a multitude of ways for them to get their documents into us. And we also have tried to adopt processes that consider the fluctuation in earnings. So let's say I'm a greenhouse worker, and I get paid a pretty decent in the summer, and that's when my reauthorization time is. And so then I have this hefty copay, but in the fall my income level goes down. Report it to us, and we're going to lower that copay so that they, based on their income. So that is all I have for now, and I know we're going to be here having some questions later, so feel free to hit me up if you have any questions.
Those are a lot of important numbers. So thank you for sharing that. Come on up, please. Next, I have the privilege of introducing to you Bonnie Doolittle with New Mercies. And they have got, I said to her, some out-of-box thinking, some ways that they have approached childcare that are worth thinking about, that are, she's going to explain it better than I can, so I'm not going to try to paraphrase. I'm going to turn it over to you, Bonnie.
Thank you, Meg. Thanks for the opportunity to present. The first speaker, Britt, I just can relate to your story. 9 years old, me, 9 years old, in charge of my newborn baby sister. Totally, nothing happened, thankfully. She's a thriving adult today, not because of me, but I can relate to that story. I am Bonnie Doolittle, New Mercies Ministries, and we've presented here before, but Meg and Julia asked me to present specifically on something that we adopted during COVID, which we are calling our day hosting model. And so typically, from 2013 to 2019, we offered overnight hosting for parents who were in crisis, needing to get some help during that crisis in order to hopefully keep kids out of foster care, keep neglect from happening, and to support and stabilize families. So that's what we did for 6 years. In 2019, we had to pivot a little bit because of COVID, and our numbers dropped, and we have these families ready and waiting to serve, but no one to serve because school was now online and just less calls coming in. But what we did find are the calls that were coming in where I really need childcare. I don't need you to keep my kid overnight. I need you to help me during the day so that I don't lose my job. So we piloted a program called our day hosting model, and it's just very simplistic, basically our same model, except we do only during the day with our same group of host families. So the purpose was at that time, and continues to be, to support families in crisis with immediate childcare solutions. And the impact is that we provide short-term and safe care for children. It helps families stabilize during emergencies like COVID. Like when we started, it was COVID, and now it's emergencies like I have unreliable childcare, or I can't find childcare, or I'm waiting for the voucher, or the voucher's not covering enough, all those things. Or I lost my childcare, and I'm by myself and have nothing. And so it's not a permanent solution, but it helps to bridge the gap for parents that are seeking long-term solutions. So they have to be able to be seeking those solutions. So like some of the other ladies said, they have to be working, they have to, or whatever, in school, training, whatever that may be. But their employment and working towards sustainability is definitely needs to be on the table before we will open this up. When we piloted it, we only opened it up to people that we served in the overnight hosting. We said we're going to pilot it with people that we know already, right? So once they went home, they had the job and whatever, we would give them 4 weeks of childcare until their voucher was approved. So long story short, that was so successful that we continued it, and now it's just part of our program. And we've opened it up to more than just the people that we have served through the overnight arrangements. So I was also asked, and I think Allie, she's like, I was very interested in hearing about your approval process, and it is, even in our overnight arrangement, it's very, very important piece of who we are, and it actually takes a while to get approved. So our program, our hosting program, overnight and day hosting, is governed by the Strengthening Families Act of Indiana. So it allows us to do what we're doing without being licensed like a foster family would. So our application process, we patterned it very closely to getting foster care approved. We only removed the components that didn't necessarily apply. Like one of them is we don't look at your financials because we don't charge for this day hosting arrangement or overnight. And we're totally privately funded. And we don't charge, but we also don't pay a per diem. We do provide through donations things that you need to care for a child, but we don't provide them with any money to do so. So we took that financial component out. So our process, again, looks very similar. Fingerprinting, local background checks, CPS checks, sex offender registry checks, and we do that for everyone that's over 18 in the household. So that's very similar to getting foster licensed. We do 3 reference checks. We require you to commit to and demonstrate and sign your life away to confidentiality. We don't want you posting, the child that you're serving on Facebook or, talking about a parent's situation out there publicly. So confidentiality is very important to us. Back to my mom's situation, the reason she didn't ask for help is because she was socially isolated. And at the time, today's my birthday, I'm 59. So 59 years ago, or 49 years ago, when I was taking care of my sister, it was shameful. She had gone through a divorce, domestic violence, all the things, and it was shameful back then to ask for help. So this is why confidentiality and social media practices are very important to me, because we want to make it an experience for our parents that is not shameful, and we do not want them to be socially isolated. These families that serve them are very much, they become extended family. We have multiple people that just come back time and time again. Sleeping arrangements, so there's policies for that. Corporal punishment, so discipline practices are very much governed. Additional requirements, driving kids around, whether you're going to or not, we require all these things in case there's an emergency and you do have to go somewhere. So all of that, plus pet records, we require that. Final steps, and probably some of the most important. If you get this far, you're really committed. So we have a 4-hour training session that you must go through. Any parent or child-facing volunteer must go through. We have a home evaluation, and we actually use the live checklist that DCS uses to assure that we're above reproach on checking out their home, and we make almost no exceptions. If there are exceptions, it's very, very unique exception. And then we have a 2-month waiting period before you can get even approved to do your first thing. And we picked 2 months. Our insurance company suggested 6 months, and I'm like, we'll never get anybody across the finish line. So we picked 2 months because of the national research that pedophiles seek ministries to find ways to abuse children. And if you have a waiting period, they go to the next ministry. So we decided we needed an approval or a waiting period. So it's very extensive, very close to foster care. Want to alleviate fears around that. Even though we're not licensed, we're very much certified, and there are eyes on these arrangements. Okay, day hosting details. I'm going to go over here so I could see. The length of stay, when we piloted, we said 4 weeks. We pretty much stick to that. And that typically is, on average, what we do still, even today. However, we will make exceptions. We probably are going to have to make more exceptions based on this 11,000 waiting list. But we do 4 weeks currently and evaluate weekly and then look at it really at the end of the 4 weeks. Should we continue? Is this helping the parent? Where the parent must be in a parent-driven crisis, so something related to some sort of thing that they're dealing with. They lost their job, domestic violence, they left a situation in a hurry or some parent-driven crisis. I'm going to lose my job if I don't have childcare. That's probably for today's meeting. This is probably the most applicable crisis. They have to have applied for the voucher, or within very soon after, they have to be in that process. Even if there's a waiting list, we still want them to be in that process. We want our representatives to know what the need is out there. Coaching, they must be willing to be coached each week. Mindy Theard here in the front, she oversees our coaching volunteers, and they meet with our parents, and they also check on the kids once a week. So they must be willing to meet weekly, and that family coach volunteer will help them navigate the voucher process if they're not already in it, and they will help them. They will walk alongside. That's the term we like to use. We don't do it for them, but we will connect them so that they know where to go. And then they have to sign an agreement agreeing to this day hosting arrangement. Statistics, so to date, and I'm counting mid-July 2021 as when we really said, yes, we're adding this to our model. It's no longer being piloted, we're doing it. We have served 50 families, and I thought this is really neat. It's right, like even number there, I love numbers. So we've served 50 families to date since we launched officially, and 60 kids from those families to date. And we currently have 63 host families who are eligible to do this. That doesn't mean all of them do it. Some stay with the overnight arrangements. Some stay with weekend care. That doesn't mean they're all available, but they're all approved to do so. And actually, it's kind of the trend with our host families that they really love the day hosting model. So we're excited about that. I wanted to leave you with a story because I think our program tells the story. It explains it best with a story. So change the name, but Diana's story, her crisis was she, in a hurry, left a domestic violence situation. She had unreliable childcare already, and it continued to get worse after after she left her abuser, then her childcare continued to be a problem. It was a problem before, it continued to get worse. And that unreliable childcare caused her to lose her job. So they would just randomly say, I'm not taking kids today. I don't know all the ins and outs, but randomly just say, I can't take your son today. And then she finally just lost her job. She found a new job, but because I think she used our overnight arrangement too. But she found a new job and didn't need her child to be hosted overnight anymore, but she needed help with job training before starting the new job. So we helped her through that and on into starting the new job. So it took a while to find childcare because once you lose one, that's, you want to hang on, but it was unreliable and not working. So she found new childcare during the arrangement with the help of, with her coach walking alongside. And I confirmed that she did get the voucher, and she is using that today, and that is extremely helpful. But it was a long process. Her arrangement, I looked at it last night. I think it lasted like 5.5 weeks. And she already had, help me if I'm wrong, I think she already had the voucher. She just needed to find the next childcare after it happened. So 4 weeks of day hosting and coaching was the solution for Diana. And also just a neat story. She's continued to stay connected to us. The moms that we're primarily a single mom ministry. 98% of who we serve is a single mom. Might even be higher than that. But we continue to stay connected to her, and we become their extended family. And she calls us again when she needs help, and that's not a failure point, that's a success point because we have built a trusted relationship with her. Okay, so questions are left for the end. Just wanted to just share that there's some brochures on your table, and this one explains our program from a community agency standpoint, and these two are the same thing, different languages. I can get you some more if you need it. And please feel free to take those. Also, just want to mention that we're willing, I left my card on the table, willing to come and meet with your organization and share about what we do. We have formed 2 new partnerships recently. One was recently a Mother's Hope, and if you're a Mother's Hope resident, you automatically get 4 weeks. You get connected to us right at the beginning, and you get 4 weeks of day hosting while you're looking for your job. And every child that goes home from Parkview North gets our brochures, these brochures, so they're introduced to our program. And somebody mentioned earlier that, Britt, I think it was, mentioned if you go to the hospital with your child, they'll call DCS. We have started receiving calls instead of DCS. And we have kind of got things going with Parkview where we just show up and we're able to help instead of having the child have to go to DCS for a temporary moment. So, thank you.
Will my speakers come up? I know that we started a little late, but I think we have a few minutes for questions. We were trying to hold the questions till the end, and so this is going to be perfect time. If you have any questions, Meg has the microphone. This is your time. Does anybody have a question? I know that I had a question that I kind of wanted to open the panel with, and so I can go ahead and ask my question to kick us off. We've heard so much about childcare and how it's such a need. And then I got to thinking about a lot of those kiddos that also have special needs that go beyond your normal setting of childcare. What, if anything, is that situation looking like, and what opportunities are there for families to be able to find, specialized care for their kids that need a little extra?
Well, for families that have special needs, they can reach out to the Child Care Resource Network, and they have a list of trained providers. Also, the CCDF voucher does pay an additional 10% to those providers when there is a child with a documented special need.
For the children with the special needs, do like an IEP qualifies for that special need, or does it have to be a doctor note?
It can be the IEP, or it can be a doctor's note with a specific diagnosis, as long, because some families haven't gotten to that IEP stage yet, so it can be a doctor's note as well.
And then for the April 9th
yes.
passport, is there any items that the parents need to bring?
ID for the adults, the child's birth certificate, or documentation of birth. It can be their birth confirmation letter, and then proof of income, and then proof of their residency. Many have it on their ID, but yes, proof of residency.
Thank you.
I used to be a Medicaid waiver case manager, and that was for people with disabilities. I'm not used to being on a microphone, sorry. I've been out of the field for 5 years, but as far as I know, this has not changed. If a child gets on the Medicaid waiver, there are respite services. They're limited because there's a certain fund that's provided each child per year. But they can get respite services through their Medicaid waiver, and that's a whole complicated process. That's why they have a case manager. But just so you guys know that there is a whole nother field of work and support for people who have disabilities.
Hi. for a mom who is wanting a host, either overnight or a day host, how long does that process take?
Well, depending on what the need is and depending on availability of host family, we can turn it around quickly. We prioritize our calls, our requests that we get every day based on the need. So it's not first come, first serve. It's based on priority of need. So if you're having a baby 2 months from now, we're going to be looking at that a little later than someone else. So we've turned them around as little as 2 hours, but we like at least like 2 days. So if you're going to have a baby, let us know right away so we can help you if you don't have help. If you need overnight hosting, if you have a job starting, don't wait until, a week before if you know you're starting in 2 weeks. But call as soon as you have the need. And like I said, we prioritize every day. So it depends on the need, how long things last. The higher the emergency, the quicker the turnaround. But we try very hard to prevent the need for them going into the foster care system. So if that's like imminent, then that's going to get scaled up the list. If you're on your way to the ER, that's going to get scaled up the list. So really, it's just based on the need.
Thank you.
Is there an age limit for kids that could go inside host homes? And then also, is there a number of kids limit? So like of 5 kids, 6 kids, 2 kids, and then do you take all kids up to 17 and a half?
We take kids, newborns home from the hospital if that's the need, so 0. And then our brochure says age 20. What that means is we can take, like I said, that 20 is ours. When they hit 16 and a half, we're allowed with the law that governs us to take an unaccompanied youth in. We have one of those right now. And we're allowed to have that without parent consent once they get to 16 and a half. If a teen is pregnant, that gets scaled up the list. We really want to make sure that we're coming alongside a pregnant mom, a pregnant teen. But yeah, all ages. Our program basically is 0 to 20. And we try very hard to keep kids together, so no, there is not a limit to how many kids. That doesn't necessarily mean, and I want to caution you in expressing this if you're explaining our program, often what happens is they have to go to different host homes. But we try very hard to keep them together if that's possible.
Are there any other comments from the experts all around this room on something you think the group would like to know that we haven't covered?
That's my last thing. So I do want to express on behalf of the department that if we do receive a call to come to the hospital, in the example that Brett had provided about like maybe a parent doesn't have that additional child care for her other children, we do not provide temporary child care. Like we have to detain those kids. So then that puts those children like in our system. So we just want to caution people if there's other resources to utilize those first.
I just want to add, thank you for sharing that. We learned that recently and really have made a push to have the social workers at the hospitals call us, because those are like the easiest ones, because we know there's an end date like really soon. They're going to want their other kids back really quickly, and if they have to go into the system, that process is so much longer than just a few days. So thank you for saying that. Oh, DCS. The lady is at DCS. Yeah, we don't have an official partnership, but you guys are our top 5 referring partners. So thank you. It has been my dream since I launched this thing in 2013 to come alongside DCS to relieve the pressure on you so that you're handling just the ones that need. There's very much a need for foster care, but we want to come alongside and be a support to you to create those safety plans for parents so that there isn't a need for them to have their kids hosted. It breaks our heart when a parent has no other help and they say, I'm just going to call DCS on myself. You know, that's a hard day because, you know, they don't want that, but they're in a situation they can't keep their own kids safe. So thank you for that. It has been something I worked on for a long time, and just for what it's worth, the first time we had a conversation, they rolled their eyes and said, you'll never make it here. And here we are, 12 years later. So, and you guys are in our top 5. Pardon? Yes, we get your permission and we work alongside you. So we basically get in the back seat so you can drive the situation if you want to stay focused on that family, and we allow you to come into our host homes, and our coach works with the caseworker. But we have heard such relief from you guys that, hey, we know that you're involved, we can take our eyes off. So thank you for that.
I just wanted to tell you, Bonnie, that I've used your services for my clients 3 times over the years, and you guys were a lifesaver. So I just want to say publicly, thank you very much, and you're worth your weight in gold.
Thank you. It's all the volunteers. I'm just up here raising money and telling the story. They're doing all the work. So we have 225 volunteers now, 63 host families, 16 coaches, and then a lot of support for our host families in the rest of those volunteers. So it's definitely a circle of support, providing holistic care to the families we serve.
Well, thank you all for your time, and I think it's just a little bit after 1, so we'll let you have a good afternoon, but thank you for joining us. If you have any suggestions for our future luncheons, we always welcome your feedback.
Yes.
Thank you.
Please fill out the surveys, you guys, if you have just a couple minutes. If anything, at least the suggestions, because that really helps, because all this is for you guys to be able to provide resources and education. So one more round of applause. I really want to thank our speakers.